The clavicle, or collarbone, is a crucial bone in our body. It acts as a bridge connecting the arm to the main skeleton. This connection allows for a wide range of arm movements. The clavicle also protects important structures in the neck and shoulder. These structures include blood vessels and nerves. The clavicle's position makes it vulnerable to injury. It is relatively exposed and can be easily impacted during falls or collisions. When excessive force is applied to the clavicle, it can lead to a fracture. A clavicle fracture means the bone is broken. This often happens due to a direct blow to the shoulder. Falls are a common cause of clavicle fractures. Landing on an outstretched arm can transfer significant force to the clavicle. Sports injuries are another frequent culprit. Contact sports, cycling and skiing carry a higher risk of clavicle fractures. The force needed to break the clavicle varies with age. In young children, the clavicle is more flexible. A green stick fracture, a partial break, is more common in children. In adults, a complete fracture is more likely. The clavicle is not uniformly strong along its length. The middle third of the clavicle is the weakest point. This area is most prone to fractures. Fractures in the middle third of the clavicle account for the majority of cases. Fractures at the outer third of the clavicle, near the shoulder joint, are less common. These fractures can sometimes involve damage to the ligaments that connect the clavicle to the shoulder blade. Car accidents can exert tremendous force on the body. In a car accident, even without a fracture, the clavicle can be compressed. This compression can injure the underlying structures. Nerves and blood vessels that run beneath the clavicle are particularly vulnerable. Damage to these nerves can cause a range of symptoms. Numbness, tingling, and weakness in the arm and hand are possible. In some cases, surgery may be necessary to relieve pressure on the nerves and restore function. Clavicle injuries, from simple fractures to nerve compression, highlight the importance of this bone.